Welcome everyone to our celebration, commemoration, and honoring of World AIDS Day. I am going to give just another minute or so for people to continue to join us, but wanted to thank each and every person who's gathered with us already to mark this time today. We'll add just another moment. So again, welcome. I really do appreciate people taking the time to sit with us, share with us, even if we can't be together in person, and to commemorate World AIDS Day on behalf of the Arnhold Institute for Global Health, on behalf of the Icahn School for Medicine at Mount Sinai and the Mount Sinai Health System. We're really honored to be able to host this virtual gathering today in honor of World AIDS Day. My name is Rachel Freeman. I am a pediatrician and an HIV researcher. My work, both clinically and research-wise, has been focused on the long-term challenges for children and adolescents growing up with HIV, particularly those children and adolescents who are infected with HIV perinatally, meaning they're infected at birth. I've worked for almost 20 years now in the space of providing better and better HIV care for children and their families. And most of that work that I've done has taken place in a partnership in Kenya and East Africa. And I'm going to talk a little bit about that today. Again, the Arnhold Institute for Global Health is really honored to welcome people for this space today. Our time together is going to have two phases. We have this initial shorter section where we're going to hear some of the stories from children and youth living with HIV, and then we're going to move into our keynote discussion with Dr. Linda Gale Becker, who we're excited to be hosting. We do hope that this can be an interactive time. Please feel free to put questions in the chat, to share any resources that might be applicable to what we're talking about, and we'll try to do the same. So again, we want to come together today on December 1 to commemorate World AIDS Day. December 1 is when World AIDS Day is marked every year. And for this World AIDS Day, we want to focus on the unique needs of children living with HIV. Globally, HIV remains a significant concern for children's health. There are 1.7 million children estimated to be living with HIV right now, today, and 90% of those children live in sub-Saharan Africa. Now, I know that numbers like that are sometimes difficult to wrap our arms around in terms of whether they're big or small or what that looks like, but that's about the same number of people as live in the state of Idaho, for example. That's still a lot of children. And especially when we consider that this is an infection we know how to prevent, and that this is an infection that we know how to help people live with, assuming they're able to access HIV medicines. What I'm going to do today to start us off in our celebration of World AIDS Day is to share a personal story and another story in the words of an adolescent living with HIV in Kenya. We had hoped to have more adolescents joining us live today in a way that didn't quite work, but I hope that by sharing their words and sharing a video that includes some of their stories as well, that it will give you a sense today about what it looks like for children and adolescents to face this pandemic. Now, then we'll have a brief break, as I said, and out from 1 to 2, we're going to be joined by our keynote speaker, a world-renowned physician scientist and infectious disease researcher, Dr. Linda Gale Becker from South Africa. And I hope everyone will be able to stay with us throughout the time as much as possible. So this year, 2021 marks the 40th anniversary of recognizing the HIV pandemic, of the first descriptions of HIV as a recognized disease. Now, we know that the virus was around before that, but 1981 is when we first had official, reports in the scientific literature. We began to piece together what this disease looked like. And as we mark this fourth anniversary of sorts for HIV, our theme is End Inequalities and End AIDS. That's the global theme set by the World Health Organization and the UN's group focused on AIDS as well. Now, of course, all of us have witnessed together over the last, year and a half, almost 2 years, what it looks like to see an infectious disease pandemic not only ravage the health of people around us, upend our lives and our health systems as we know it, but also we've seen how COVID has further exacerbated inequities in health around the world. And I hope that as we think about HIV and as we think about our very recent and current experience with COVID, that we realize anew that pandemics, they don't end until they're over for all of us. This is true for HIV. This is true for COVID. We know that this dream of a generation without HIV is possible. And so I hope today that we can really recommit ourselves together for this becoming a reality, for ending the HIV pandemic everywhere for everyone, and that includes children as well. So as you can imagine, as a pediatrician who's focused on caring for children with HIV, as a researcher focused on HIV care, a World AIDS Day is very close to my heart. In fact, in a lot of ways, I feel like every day is World AIDS Day in many ways for me. But every year I do try to mark and reflect on the stories of the children that I've known over these years who have been affected and infected with HIV. And for me, those stories are what motivate me. And I hope I, by sharing them with others, can motivate others to think about how we can prevent and better manage HIV for children who are still living with it today. Every year on World AIDS Day, I tell the story of faith, and I'm going to tell you that story again today. And I do this for a few reasons. First of all, Faith was the first child that I lost personally to HIV. When Faith came into the hospital in 2004, she was 4 years old and she weighed only 11 pounds. Now, for those of you who have experience with babies, a baby should weigh 11 pounds by the time they're 4 months old. It might even weigh a lot more than that at that point. But Faith was 4 years old, and that's how little she weighed. I'm actually going to share my screen here a minute to show you a picture. Sorry for the delay here. So this is Faith, how she looked when she came to our hospital and when I met her, Faith and her mother, Rose. And now looking at Faith, I suspected that Faith had HIV, in fact, that she had AIDS, even before we did any tests, but our tests did confirm my worst fears. And sadly, Faith died just 2 days after she was admitted to our wards at the hospital in Kenya, the Moi Teaching and Referral Hospital, where I continue to work today. And I had given Faith's mother a copy of this photograph that I took of the two of them. That time we were taking photographs of all of the families on the wards who wanted them and printing them immediately and giving them to families. It was something that they really appreciated. And when Faith died, I will never forget her mother thanking me over and over again for making this picture of her daughter. And she was so grateful. And I felt so terrible because after all, I had not saved her daughter. I felt like I had failed in the worst way, like I had hardly done anything. But she was grateful for even this picture because she didn't have another picture of her daughter. And The reason that I remember Faith every day and talk about her every day and and every year particularly, I remember her every day, but why I do make it a point to try to talk about her every day publicly wherever I can on World AIDS Day is that we celebrate World AIDS Day on December 1, and Faith's birthday was December 1. So not only is she a patient who, I lost to HIV and who in many ways was part of directing the rest of my career and my research work towards this challenge of dealing with the HIV pandemic, but we honor Faith today because this should have been her birthday. In fact, she should be turning 21 years old today on this World AIDS Day in 2021. And let's, think about the things that 21-year-olds do. Faith should be, maybe falling in love, studying something she's passionate about, making big plans for her life. And so when I think about Faith's story, even though it's certainly a sad one, it helps me to remember why it is that we are here and where we are as a global community exactly 40 years after HIV was first reported. Because really, this is a story about how these stories of people living with HIV can now have such very, very different endings. This is a story about what it looks like to be able to access healthcare and access treatment for HIV that you need. If we'd been able to start antiretroviral medicines, the medicines that fight HIV, in time to prolong Faith's life, she might be doing those things we'd hope today. She might be in college. She might be planning for a long future. We would hope for all of that for her. She might be, learning and laughing and dreaming today. If we'd been able to start these HIV medicines during her mother's pregnancy, Faith would not be infected today. We know how to prevent over 99% of HIV infections from being passed from pregnant people to the babies that they give birth to. And if we'd been able to start antiretroviral medicines for whoever it was that infected Faith's mother, her mother too would be alive and would be free of that incredible, terrible guilt, dealing with the constant stigma, everything that comes along with having had this virus in your body and passing it on to the child that you love so very much. We know how to prevent HIV infections. And this is really where we find ourselves today as a global community. We have the prevention strategies, we have the treatment options, the science is there. What we really need is for the global will to be there. We need for the funds to be committed and committed again. We need to keep up this fight. In the same way that we are now saying, hey, we have the science for COVID there, and we know what needs to be done. Let's try to move this science forward for all of the world's communities as well. Our very real goal for every single person who's living with HIV today is that their antiretroviral medicines would suppress the virus that they're infected with so much that it's undetectable in their blood. And when the virus is undetectable in your blood, which is our daily goal for people living with HIV, you cannot pass HIV on to someone else. We say undetectable equals untransmissible, or U equals U, meaning you don't infect other people once you're on these medicines. And this is part of the story of what we need to spread today as well. Information about what it looks like to prevent infections. And I hope we can take some even small steps in knocking down some of the stigma that remains around HIV infections. This should be just one more disease that we think of people living with, like asthma, like diabetes, something that's very manageable with medicines, something that we can prevent from spreading onward, and something that we continually strive to make the prevention and treatment accessible to every single person. I wanted to share one more story and the specific words, the specific voice of a youth, of an adolescent living with HIV today. because this was the story of faith from the very early years of the HIV pandemic, when in fact our hospital wards were full of dying children and dying parents and others who were dying as well. Now our stories of people living with HIV look very different. They look a bit more like Peter's story. And so I wanted to share Peter's story in his own words with you today. So I'm going to read from his words, gathered in one of a set of interviews that we've done with adolescents living with HIV in Kenya again. Peter is 13 when he tells this story. His father had died from HIV about 1 year before we were talking with him. And he's been struggling with taking his medicines for HIV for a number of reasons. These are his words. I was so bad with my medicines. I just didn't remember to take them. I love soccer, and it's so hard to remember to take medicines when you're busy playing soccer and doing things every day like I am. I wasn't trying to skip the medicines. I just forgot. And I didn't know why I was taking these medicines. I felt strong. Then I was missing too many medicines. I became sick and I had to go to the hospital. That's when I learned that I had HIV. When I was released from the hospital, I just wanted to say, that never happened. I don't have that disease. At school, they said HIV was only something that came to bad people. I was feeling better, and I thought this was a mistake. I wasn't one of those people. I think I was in shock. I didn't believe anything like this could happen to me, and I didn't take the medicines. I started to get sick again. I wasn't playing soccer much, and the other kids noticed I was too weak to play. They started talking about me and spread rumors about me, saying that I had that disease. I didn't like the medicines, but I started hating being sick. There was a nurse at the Rafiki clinic who helped me know about the medicines. And she introduced me to a group with other kids who were taking the medicines just like me. It was easier to remember after that. I still feel stressed at school. I want to forget that I have this disease, but some of the other kids call me names. It helps me when we have time to talk together in groups at the clinic. It helps me remember that I am not the only one, and I am learning how to accept this disease. So you might hear in Peter's story, some of these critical challenges that children do face as they move into an adolescence of living with HIV. They struggle over taking these medicines, as every single person would when you're talking about, 3 or maybe more medicines that you're often taking twice a day, every day, potentially for the rest of your life. They struggle with all the normal adolescent stuff of wanting to become, more autonomous, to push limits, to feeling invulnerable. They place a lot of importance on their peers, and they don't want to seem different from everybody else. They're often struggling with learning for the first time that they have this infection, and especially learning about HIV in the context of a lot of stigma and discrimination and very real risks for those who are living with HIV. And, the social context of what they're walking through, not only that stigma, but also navigating things like their sexual debut, starting to grapple with, other stresses such as losing parents, such as economic instability, currently the incredible demands of the COVID pandemic and the way that that has stripped financial resources, opportunities to go to school, and many other forms of support from all youth, but especially youth living with HIV as well. So there's a lot that they're wrestling with. But I wanted to talk and to share with you one more piece about what it looks like for youth and how we might support youth who are living with these challenges. At the Arnhold Institute, we are incredibly privileged to be in a long-term, deep partnership with Moi University and the Moi Teaching and Referral Hospital in Western Kenya. And part of what we're doing out of that partnership is to try to build up together an adolescent treatment program that would support first adolescents living with HIV with holistic care, and then provide adolescent health services across a wide swath of Western Kenya, across more than 400 clinical settings for both those who are living with HIV and those who are not. I'm going to share a quick video, which, as I said, captures some of what we're trying to do in Kenya currently. Apologize for my sharing slowness here, and I'll let this speak as well now. The Arnhold Institute for Global Health is committed to the most critical issues in global health today. We're really devoted to addressing the impact of HIV for adolescents and young adults living in sub-Saharan Africa and in Kenya. The coronavirus pandemic has made things even more difficult for adolescents and young people living with HIV. Not only are they potentially immune suppressed and therefore more at risk of getting seriously sick, of dying from COVID infections, it's also dramatically changed their ability to access the medicines that they need every day. We want to change the story for children and adolescents growing up with HIV. We want to be there for every step of the adolescent's journey to help them live a full, productive, healthy, and happy life with HIV. The Rafiki Center provides a safe haven for adolescents living with HIV. Not only do we provide medicines and the clinical care for HIV that adolescents desperately need on a daily basis, but they also get a lot more than that. It's a place where they can be in peer support groups. We have counselors available to them. There are job training opportunities. Those are critical to the adolescents' overall health and their well-being.
Through my peer mentorship, I've seen a lot of improvements in terms of stigma, in terms of disclosure. It has really boosted up confidence in every adolescent.
We're trying to make them not see that HIV is a limiting factor, that they can achieve whatever goals they can set for themselves, fulfill their dreams, complete their education, start families if they want to, just live into their full potential.
Philanthropy plays a critical role in being able to broaden that support that adolescents receive and provide the kind of wraparound care that adolescents need to be healthy and whole. Our hope is that every child and adolescent living with HIV knows that they have a bright future ahead of them. We want to do everything we can to make that future possible, not only for adolescents and young people in Kenya, but really around the world. So thank you again for joining us today. Thank you for taking this moment and time to honor and commemorate World AIDS Day. I seem to have somehow lost my notes there, so I'm not sure I can stop screen sharing there. But truly, thank you for taking this time and for your interest in learning more, by being here with us virtually, for your support for Kenyan adolescents living with HIV, and for standing more broadly with children and adolescents and young adults living with HIV around the world today. If you're able to do so, we are trying to raise money specifically for the Adolescent Health Referral Center for those youth living with HIV in Kenya right now. Particularly during the pandemic, we have had a lot of emergency needs for youth there. This includes, the few dollars of support that it takes to provide transportation for getting to the clinic and getting medicines, for trying to run our peer support groups, be able to continue to provide the peer mentorship and counseling support. We're going to put a link in the chat if you are like to and you're able to. We'd love to and very much appreciate donations that would go directly to the Rafiki Center and our partners in Kenya today. these peer support groups, having access to a counselor, learning the skills and the job training that the center is able to do, they all make a huge difference in the lives of Kenyan adolescents. I'm actually thrilled to report one of our peer mentors, a young adult living with HIV who's sort of grown up in our clinic system, did get married this last weekend. And, nothing as a pediatrician brings me more delight than seeing kids who once we were, told didn't have a future enter into adulthood, even if they then become not my patients anymore as a pediatrician. But we really do love seeing the futures that are ahead of these youth. And I appreciate everyone standing with today. We are just a few minutes before 1 o'clock. As I mentioned, we're going to transition into a discussion now at 1 or at the top of this next hour with Dr. Linda Gale Becker, who we're incredibly excited to talk with today. We're going to take a quick break as we do so, but I would note that we do have these links in the chat box, and you're welcome to just stay in here in the session as we prepare for the next moment. Again, we do have links to the work that we do in Kenya through the AMPATH partnership and with Moi University School of Medicine and the Moi Teaching and Referral Hospital, as well as the link for direct donations to the Adolescent HIV Care Program, if you are so inclined to do so. We also included a link for the short video describing the work there. And then we'll come back in just a few minutes for our discussion with Dr. Becker. I really hope that everyone stays and that we have more joining as well. Thank you again for this time, and we'll talk more soon. Hello to everyone who is here with us, or whether rejoining with us for World AIDS Day or joining on this hour for the first time. We're really delighted to have you with us today. Again, welcome to World AIDS Day. We appreciate you marking this time with us and standing together with Mount Sinai and the Arnhold Institute for Global Health and the global community as we commemorate, honor, mark World AIDS Day together on December 1, as we do every year. We're incredibly excited to have Dr. Linda Gail Becker with us today. I guess for a reintroduction, my name is Dr. Rachel Freeman. I am a pediatrician and researcher who focuses on the care of children and adolescents who are living with HIV, particularly in sub-Saharan Africa. I'm the director of the Arnhold Institute for Global Health, where we're hosting this webinar session today. Let me just welcome everyone to please feel free during our time today to put questions that you might have, or comments or resources or links that you might want to share into the Q&A box. We do want this to be an open discussion. I'm going to be asking some questions and we're going to be talking back and forth, and we'd be happy to try to address questions that you might have today as well. I would like to go ahead and introduce Dr. Becker. I am incredibly excited, and we'll try not to gush too much, but to have a chance on this busy World AIDS Day to talk with Dr. Linda Gail Becker today. Dr. Becker, Professor Becker, is the director of the Desmond Tutu HIV Center at the Institute of Infectious Disease and Molecular Medicine at the University of Cape Town. She's a chief research officer for the Desmond Tutu Health Foundation. She is a physician scientist and infectious disease specialist. Her research interests include programmatic and action research around antiretroviral treatment rollout, TB integration, the prevention of HIV in women, youth, and men who have sex with men. Dr. Becker has also been extensively involved in work more recently related to COVID-19 vaccine trials. She co-leads a study that is looking at and has now moved forward the vaccination of over 500,000 healthcare workers in South Africa. She's led lots of critical investigator-driven studies in HIV treatment and prevention, as well as in tuberculosis. And she's a past president of the International AIDS Society. She served as the international co-chair for the International AIDS Society's conference meetings for the 9th and the 22nd meetings, and co-chairs the Research for Prevention conference as well. She is truly one of my own personal heroes, as well as someone who is just fun to talk to anytime I get an opportunity. So I'm really excited to have you joining us today from South Africa. And I so appreciate your time today on a busy World AIDS Day as we're together. So welcome, Linda Gail. It's really delightful to have you with me today for this discussion.
Rachel, always a pleasure to talk to you, and thank you for shining such a beautiful spotlight on children and the children needs in the world today. So really glad to be here with you.
Thank you. I'm delighted to talk about this together. Now, I am really eager to talk with you about adolescence and World AIDS Day, and to really discuss, as you know, we've sort of titled this section, what it looks like to end the HIV epidemic for the world's children. But I do feel like, given where we are in the world today at this exact moment, that we would be remiss not to talk about and address the incredible, very current impact related to the Omicron variant of COVID, and what that looks like, particularly in South Africa today. Thinking, of course, about recent, travel bans, how things must be going on the ground right now, and so, just bearing in mind where we are and what is happening, I thought maybe we could spend a little bit first hearing from you about what the current situation is around you in South Africa, and starting to think about not only COVID and that, as well as the HIV pandemic, and how we start to address those two pandemics together. I know that's a big question to start with, but again, kind of framing for where we are at this moment in the world on December 1 of 2021.
Yeah, thanks, Rachel. And surreal it is, because I think, I don't remember a World AIDS Day that's been quite like this. that sort of crashing of two epidemics. And as you know, we have other epidemics here on this continent as well. So, keeping in mind tuberculosis, malaria, and just all our other sort of issues. There's no doubt that the last week has been, I suppose, frightening, a real sense of unpredictability and a real sense, I guess, really of isolation on the continent. Almost a sense of, oh my goodness, I think we are alone in this. We have to find our solutions. Not wanting to have a victim mentality. We've been really good at finding our own solutions in the past, but I do think, again, there's a real sense of somehow, as a globe, we need to find a better way of dealing with our crises. I think it just really sort of throws a real focus on inequality, and we know that often the greatest victim of inequality, of bad global policy, are the most vulnerable, and too often the most vulnerable are those individuals who are too young to have voices of their own. And so that does cause a great deal of anxiety for me. Just that, I think as we reflect today of World AIDS Day, is what have we lost? How have we regressed? Where is the backsliding? And there's no doubt that COVID-19 has had an impact on our response. And, my great concern is the population that was struggling the most in terms of treatment access was children. In terms of morbidity and mortality was the adolescent population. And, I think we have to really take a very strong, firm look at where we are and redouble our efforts, really call ourselves to arms in this regard and to action to turn this around. So I'm afraid not a happy note, but one of urgency and concern.
Yeah. I completely agree with you in this sense that, even this week's, findings and the global response to, what I feel like we should be so thankful that South African scientists were reporting. The global response, highlights again the layers of inequity and inequality, and that truly the most vulnerable are being punished again and again in this way. And that, rather than finally embracing this true sense of global health, that, these pandemics don't end until they end for all of us, that they don't end until we all have access to treatment, that we all have access to prevention, rather than taking, redoubling efforts to solve and to resolve those inequities, whether, in vaccine access or access to other treatments. We instead see again, responses that are not based in either science or that perspective of ending inequity, but instead are, isolating and walling off and blame and so on as well. And I found myself worrying too, and thinking about this in the context of HIV, that as, and of course, there's a lot of intense scientific scrutiny going on about how did this variant evolve, and like what exactly is happening, as you well know, and even even starting to see signs within that of there being a temptation to kind of put blame or assign, and with that assign stigma potentially to people living with HIV, that would be somehow ascribed in that way to people as well. So there's definitely a lot that's very sobering on this World AIDS Day in that way.
Yeah.
Perhaps on go ahead.
No, I think that the huge danger, and one that I've felt, we have to really push back hard on, is this concept that the only immune compromised people in the world are people living with HIV, or that variants only occur in immune compromised people. That, that is a theory, and it may well be true, but it may not be the only situation. And, the virus replicates. It replicates
Right.
everywhere. And so again, you know, I think what we need to rather be thinking about are the solutions to how we prevent, move forward, and make sure that we stop replication in whichever way we can. And that, I think, is a more constructive use of our time.
Absolutely. Moving towards solutions and not getting stuck in blame and isolation in that way. So perhaps on a more positive note, you know, one of the things that I have long admired about you and that I continue to find inspiring and that I think we share somewhat is how much you love and appreciate and think about adolescents and young adults. So I would joke, like, my completely unbiased question, you know, would be to start off like, why do you think adolescents are the best possible group to work with in the entire world? And why, but in more seriousness, like, why are adolescents so deserving of our focus and all of the attention that we can bring to them on this World AIDS Day?
So Rachel, you've discovered the secret I did, that they are the most fun population to work with. So, you know, makes my job a happy and cheerful one on the one hand. On the other hand, I mean, it makes perfect sense, right? We, particularly being on this continent, but around the world, we're about to move in, well, we have already moved into a youth bulge. Young people are, particularly on this continent, becoming the largest population. And they, you know, they unfortunately are most vulnerable just because of developmental, you know, situation that they're in, that they're becoming sexual beings, they're discovering their sexual identity, they're beginning to experiment. And HIV, of course, is a sexually transmitted infection. And so they are naturally, this is not anything that they do wrong, they are naturally more at risk of HIV acquisition than other populations. We also know that, you know, if people are going to experiment with substances, they often start young, etc. And they're discovering their sexual identities. They're often experimenting in different, again, very natural, very normal behavior, but it puts them at risk of HIV in particular. And I just want to say it also puts them at risk for airborne conditions. So we know adolescents are the first group where they start to get infected with tuberculosis. Why? Because they like to hang out and they go to places and they, you know, get into buildings and hang out together and mix more with adults. And so we see that this is a population where not only do we need to have solutions and an impact, but there is an opportunity for prevention because we can actually get in front of that risk and stop it happening. And then we realize the triple dividend. So not only making sure we have a youth population that is healthy, but also tomorrow, an adult population that is healthy. And of course, tomorrow, you know, parents who are going to be healthy and have healthy attitudes towards their own children. So the triple dividend, you know, to my mind, it's a kind of no-brainer, as well as being great fun. You know, it's the population, Rachel, you know, that keeps us honest. They hold us to account. They, you know, are totally unpredictable. They, you know, they don't have great expectation, but they just do get the very best out of us because you really do want to provide the best you can for them. And so, you know, I continue to really derive great pleasure and have my own batteries recharged at regular intervals. They keep you young. You know, what's not to love about that? The elixir of youth. We've discovered. So, you know, it makes good sense from a public health point of view, but also just from a moral and right thing to do. You know, this is a population with great expectation, with great potential, and we can realize that with not too much investment. I mean, it's surprisingly little investment to be able to move this forward.
Absolutely. You know, and I think it is that, you know, I think we do often find too that the creativity and, novel solutions that our adolescents are thinking of for how they are, making their own way and living their lives can really inspire us to figure out how we can, provide them with the supports that would also, meet our public health goals and prevent infections and those things too. And I think it is so critical, just as you're saying there, that, even if, as we talk about the layers of vulnerability that they have, the multiple challenges they may be struggling through, the ways in which both HIV and COVID and the other, systemic pandemics of racism, of discrimination against them, of economic insecurity and sexism and so on, just as there are all these giant weights that at the same time, though it sounds like a cliche, they are our future. Like they are inevitably, where the world is headed and who will be leading and who will be telling the next chapters of this story, and everything we can do to invest in that future, I think makes so much sense that way.
And Rachel, I would just add, if anyone's sort of sitting on the fence about whether to work in this area, the amazing thing about this population is they have not yet become cynical. So, where we think of a million reasons why something might not work, and therefore we don't even try. A young person, has the adage, which I love, of if I can think it, I can do it. If I have a problem, I can find a solution. Most times they're really surprised we haven't actually found the solution yet. It's like, how is it that you don't know how to fix this yet? And they're so keen to contribute to finding that solution. So again, truly a rewarding population to work with. And I would just say that if people are thinking, isn't it too hard? Look at the ethical, legal, all the barriers, these, you can only talk to them after school, or you've got to find, do it with parents. Those are barriers that can be overcome. We found that those challenges are manageable, but really the rewards far outstrip any challenge that may exist.
I completely agree. And I'm glad that you added that, because, we do, I hope we do have trainees with us today as well, and that we can convince you that clinical work, research work, public health work related to adolescence, it's well worth engaging in that way too. We want to woo as many people as possible to the population. Apologies for the sirens going by. I'm right by the hospital here. So Linda Gale, as we commemorate World AIDS Day, as we did a bit in the first section of our webinar today, I do think it's important for us to commemorate the stories of people living with HIV and the stories that we've been able to have the privilege as physicians and scientists to learn about and to share in, as we think about what does motivate us in our research work, in our program work, in our advocacy for children and adolescents living with HIV. And I wondered whether you had any stories at all that you might feel like sharing today, maybe even a small one, but sort of where, as you think about your path in global HIV and TB work, any stories that strike you that you'd like to have a chance to just honor and commemorate today as we think of World AIDS Day?
Yeah, thanks, Rachel. So, I set out as a young physician many years ago wanting to be a geriatrician on the other end of the scale, and really quite sure that my vocation was to make the twilight years more pleasant, more to palliate, I guess, as people got older. And then, of course, I found myself in northern KwaZulu-Natal, just at the height of the AIDS pandemic in northern KwaZulu, which is really the eye of the storm for us here in the Western, in South Africa. And, long story short, found myself very much drawn to infectious diseases, went off to specialize, became an HIV doctor, essentially a TB doctor, and then very quickly realized that, this was an epidemic of the youth, of young people, and just so struck even in those days when, again, we were facing the iniquity of no antiretrovirals, no treatment, and having to take young people through a shortened life, through terminal illness, dealing with them leaving children behind, etc. Just really struck by the resilience of youth and just the incredible will to survive. And, you know, sort of getting over that hump, and then realizing that I did want to restore and give back and make sure that young people went beyond just coping with HIV, but actually had better health generally. So using HIV as the sharp end of the sword to say, how do we improve general health for adolescents, health and well-being, because it's clear that around the world, young people don't really have a good sense of well-being, which, you know, to our total indictment, to my mind. And early now, I'm thinking 2006, we were working in a community where we still work 25 years on, small, incredibly impoverished community in Cape Town called Masiphumeleli. And we asked the young people there, I sort of took them aside and said, guys, what can we do about the statistics? You know, this is terrible. One in 3 of you will become adults with HIV. How do we change this? And they said to me, LGB, look around. We have nowhere to go. We have nowhere to hang out. And it's true, you know, sometimes 11, 12 people live in a shack. The notion of having your own room that you can slam the door and go off and sulk as all adolescents should be allowed to do, that does not exist in that kind of community, you know. And we then, you know, said to them, well, what should we do? And they said, can you build us a place to hang out? And a little bit like your fantastic video you were showing, Rachel, the work you're doing in Kenya, we built a youth center in this particular community. And, you know, the striking thing of a young man who was part of our Future Fighters, our youth representative group, and is now grown up and gone on to great things. He said to us, you know what we would really love is a peace garden. And I went, what? Peace garden for adolescents? How is this? And they said, you know, we just want to go somewhere where we can think and be at peace. So we did. We built a peace garden in this youth center where they can also, you know, make a lot of noise and you know, play games and go on the web and do all sorts of other things. But they can actually go into a really quiet garden and just be at peace. And that, you know, that for me had so many levels, so many lessons, so many important things, that adolescents are the same around the world. They have very similar needs around the world, and we fail them constantly, you know, and it does absolutely warrant our time, attention, our resources, our expertise. But that we need to draw them into the co-creation of solutions, because the most unexpected answers often come. And when we design it ourselves without asking them, we make errors. So, you know, some great lessons just in that little piece for us. We've gone on, it's become a health park now. And it's, you know, and that's just one piece of work. But again, just terrific what we can do with not too much effort in terms of just changing young people's lives. Thanks for the.
Oh yeah, absolutely. No, I think that's really it's terrific to hear a bit of your journey that way too. And certainly we see parallels, as you were saying, really around the world, but in our partnership in Kenya too, in very specific ways where, you know, for me as a pediatrician, when I was initially taking care of patients with HIV in the early 2000s, those were young children dying. They were babies and toddlers, and, you know, the youngest ones who were making it through. And, you know, now with them, and as the medicines started to become available and the antiretroviral therapy, it's truly been my incredible privilege to start to have those who are born with HIV grow up and to enter adolescence and to start to be able to, walk with them through all these normal challenges of adolescence, even though, it was certainly a learning curve for us over the last decade, especially of saying like, oh, we actually do need to tell these children that they have HIV because they're going to live, which, was not something that was happening before in that way. And I think though, just as you're saying, like certainly while there's been a lot to try to figure out in terms of how we meet the needs and support those who are adolescents and young adults living with HIV really is, I like how you say sort of the sharp end of the spear, like this, it's really this starting place for how do we provide holistic care to meet the needs of adolescents? And how do we start to think about adolescent health and create care systems that provide for adolescent health needs, whether it's their sexual and reproductive health needs, their mental health needs, their general needs for peer support, for job training, for support for staying in school, whatever those things are, and trying to think about that more broadly in the same way. It's interesting. We don't have a peace garden at our our adolescent health center in Western Kenya, but we do. I often think that we have kind of one larger open room in the middle of the clinic. And I often think that's by far the most important space in the entire clinic. It's where they gather weekly for salsa dancing. It's where they do karaoke. It's where their peer support groups meet as we have them. And it's really all, things that the youth say, this is what we want. This is what we need, whatever is happening in that space. Or they also just hang out in that room. We can always go there and find, our friends and people we've known that way. But it is so interesting. We need to listen to them across these issues as well. I mean, I do think probably if we had, youth in charge of the global COVID response, we probably could reach more equitable solutions more quickly if we brought everybody together.
Out, Rachel, I would, when we've done things like we've incentivized healthy choices, so they're able to, in a number of our programs, derive what we call tutus, which is a kind of currency which enables them then to trade it in for food or for vouchers or whatever. Invariably, they'll ask for a voucher so that they can bring groceries home to mum, as well as, get a little nice thing for themselves. Very rarely, will a young person go out and just truly splash out on their own desires. It first and foremost is the need, and there's a fantastic sense of sharing. So again, I absolutely agree. I think humanity can learn a lot. And even within that sort of sense of need, just incredible innovation around innovation. Through COVID, we've been working with young people now to Uber their antiretrovirals to them, and it's worked a dream. There's just been no problem at all. And that has been essentially organized by themselves. So again, just wonderful innovation.
Yeah. And that's, I did want to talk a bit about how things have been, over these last months for adolescents living with HIV in Cape Town and surrounding areas, and what you've seen. I mean, certainly, we know, of course, for years, it is, there's the constant struggle to take these medicines every day, to access your clinic when you need to, the costs of whatever it takes to get to clinic, of, whether you have to miss school or how that works in your schedule, or there are hours of clinic operation that work in your schedule to follow up. How do you get these medicines that you need, to have the right supplies? And, of course, much of that has been made more difficult by COVID with, lockdowns, with school closures. Traveling has been more difficult. We haven't been Ubering medicines to patients, but I love the idea of that. And certainly, especially in the first months of the pandemic in Kenya, where there were very strict national lockdowns, really all of our team's attention shifted to how can we possibly get, 6 months worth of HIV medicines into the hands of our kids and young adults, no matter where they are, because some of them live quite far away from clinics, and the traveling in was not possible, and often they don't have that long. We're usually not giving them that long of a medication supply. So I think that those are critical challenges, and then combined with the fact that so many have, so many families have experienced someone in their family or multiple members of their family losing work or losing income from other strategies. We've had various natural disasters around the world as well, whether it be flooding or, earthquakes and other issues. And then, even just the sheer social problems of that come when your school has stopped and you can't see your friends, and suddenly your social life is incredibly restricted to these people, just in your house or in the very close circle around you, which I think our youth living with HIV may feel in different ways, especially if those that are, in their geographic small circle around them maybe don't know what it's like to be living with that infection as well, or when they lose the peer support that a clinic, for example, might provide in those ways. But I'd love to, I know I ran through a number of things there, but I would love to hear what you've seen and experienced as well with the systems that you're working with currently.
Yeah, so, I think, again, perhaps the folk on this webinar may not fully grasp just how severe those lockdowns have been, particularly in our poorest communities. So first of all, one kind of wonders why anybody thought they would make a big difference, because obviously they're incredibly, it's really impossible, first of all, to test and trace. It's really impossible to try to isolate. And so in many ways, we kind of locked communities together and left them in that space. And of course, young people found themselves in households where people were out of work, people were locked in. So we had really very disturbing reports of home-based violence, quite a lot of gender-based violence, a lot of abuse within the family structure. And with that, sort of on a level understandable, just because of the incredible social and economic pressures, people were out of work and starving, So communities did rally. There was a real effort to try and support each other. But really, as you say, in those early days of intense lockdown, there was just such fear. And we, here in this country, the army was sent in to try to sort of keep things under control. And, there was just huge fear. So it meant people didn't go to clinics, either because they were fearful of contagion or because they didn't understand what was available at clinics, or because clinics themselves became quite hostile. Sure. And so, it just became a no-go zone, really a war zone in many ways. So yes, you're right. We had to get very innovative about moving medication, as well as testing, as well as prevention opportunities backwards and forwards. And, despite that, we're very aware that around the country and around the world, we've seen a real impact on testing, on diagnosis, on access to care, and on uptake of services. So I think, let alone childhood immunization and all of those aspects, as well as maternal orphaning, etc. So, I think we're going to feel the benefit or the impact, the terrible impact of COVID-19 way beyond the actual SARS-CoV-2 infections for a long time to come. So yeah, we also had to convince our staff, of course, who were very fearful, that we had a job to do. And so that meant, we had to make sure they had sufficient PPE, all of us really not understanding how bad things were, and really had to kind of drive staff back into the field long before others were venturing back into the field. So, credit to many lay health workers and health workers on this continent and beyond who really just stuck with their vocation and got on with it, So it has been an extraordinary time in so many ways. And I really hope that we will learn from, what we've experienced, to ensure that if and when this happens again, we take what has worked. And I learned a new term yesterday, failing forward, which I guess is a humble way of saying we will fail, but at least let's make it count in terms of fixing it in the future, and make sure that we do it more effectively in the future. I think our kids have really suffered. I mean, the other point is, of course, schools went online, but the poorest children, invariably don't have any kinds of ways to go online. So we've probably lost a school year at least, let alone our tertiary education. And of course, that age group, which to my mind is still adolescent, the 18 to 24-year-olds, they're the ones who've suffered through tertiary education fallout. So it's for this population of the under 25s, I think it's been the most devastating in no uncertain terms,
Yeah. Yeah. And, I think certainly you're absolutely right that the secondary impacts of the COVID pandemic will continue to be understood and will resonate far, far into the future beyond this, even if we are, able to more effectively bring the COVID pandemic more, under control. We already even, starting to see signs of increases in pregnancies among adolescents and young adults, potentially seeing, increased transmission of HIV, when prevention is not available. And, also potentially if people are, who are living with HIV are not able to access their medicines or not able to take them as reliably too, I'm sure we'll start to see that way, perhaps some ongoing transmissions as well. But then even worse, I would say all these levels of stress, of economic challenge, of violence and trauma that are being added into people's lives, the delays in education, for which, of course, especially among, I think, the most vulnerable youth, that, the chance that they can make up for those gaps in education or somehow return to the trajectory they were on are just so difficult to move forward with. Of course, we don't discount the resilience of our youth, as you said, in that way. And I guess that might be, a good point to reflect on a little bit. I mean, certainly we have seen, in the HIV pandemic that there are many mental health challenges, and in the context of, I don't know, sort of more pervasive social challenges of living with stigma and discrimination and systematic inequities around you that our youth are walking through. What strategies do you think are really key when we try to think about how we support youth in building resilience and living positively and trying to, walk through those challenges more in a more supported way? And I don't know, what are some key points maybe that you've seen that we can, then advocate for better?
Yeah, so Rachel, I think there are some wonderful programs. You yourself have run some of those, but Zvanderi in Zimbabwe, their CATS model, I think, is just spectacular. So that very much settles on the peer or near peer support, and there's no doubt that is a very valuable sort of component. I think we need to be careful about how and where and what we do with a peer or near peer, but I think this Zvanderi model is really one to interrogate and to think about, and I'm pleased to say it's now really moving across the continent. People are adopting, so it's terrific. I think there are others that are very similar. I know the 3-0, in Kenya model is another one that's exciting. So I think, thinking about social structure is the one side. I think there is a lack of appreciation of the family context. And I think we could do a lot more work in terms of structuring family or understanding family structure and strengthening family ties. So we've got some work going on looking at the mother or the auntie or the older sister daughter dyad and what can be done there. Mental health within the broader family context. So far too little work being done in mental health and mental health support. So definitely that's a gap. And I think we could be doing, I'm pleased to see now Dixon is looking at the friendship bench within the adolescent population. So this is that wonderful model where, lay workers can also provide at least reasonable first line mental health intervention by literally sitting on a bench and having a conversation with someone. And then of course it comes down to the product. So I'm quite a strong biomedical person, being a clinician and a clinical trialist. And it's just really nice to see that how just the provision of antiretrovirals has got so much easier. So people now can swallow a single pill, and we've got much better formulations for the little ones, and it's just much easier to provide care. And of course, on the prevention side, the hope that we'll have longer acting interventions for pre-exposure prophylaxis. And then, the huge excitement around longer acting treatment. Whenever I'm in meetings, it's just so exciting to see how excited the adolescents are about the longer acting injectables. So, I think there's hope around those components as well, that we'll just be able to make it easier for young people to just hold it all together. Often, though, it isn't too complicated. It's about really engaging, being, providing that meaningful support. And it doesn't need to be a built youth center. I mean, we went that route just because we wanted to go that way. But often it is more about, a listening ear, a healthcare provider who's willing to spend the time, the provision of a reliable service where that young person knows they're going to find a friendly face and get a willing ear. And that's, that often is all that it takes. I know that there's some beautiful work going on in Kenya, looking at that adolescent friendly model and really finding innovative ways to teach our healthcare workers how to be more adolescent friendly. So I think these are the things that we need to do more of. And I'm excited that as we wrap our heads around tailored care, around client-centered care, around adolescent-friendly services, and not only will we provide better HIV care and prevention, but as you've already said, we'll bring sexual reproductive health along, we'll bring mental health support along, and we'll even say, how do we then take that forward to your future? How do we provide some empowerment and capacity building to ensure that you are going to get that step up into a successful adulthood? And then, to my mind, that's about all we have to address with young people, right? Sexual, reproductive health, mental health, and some kind of future support. And then it's kind of done, it's that easy, I want to say.
Yeah. I feel like you've just outlined a perfect strategy for research and for what it looks like to alter truly our health system models to support adolescent health moving forward in the future. There, one of the things that you said in the beginning that really struck me that I think is so true is that we do so. I think in medicine where we even certainly in a place like the United States where we're extremely individually minded, we're trained as physicians to really think about this one patient in front of us, and we do not as often think about the family context and really the social context around even an older adult, but certainly around an adolescent or youth in that way. And I do think that across our global settings, understanding how we can better assess and support the family as a unit and consider, certainly, not discounting at all what our specific patient needs, of course, but how their needs and their health and their challenges and opportunities are truly shaped in all of these dimensions by whatever the family is that is around them, as well as by their, their neighborhood, their peer community, and so on, and begin to not only find strategies for improving that support, but really understanding more what that looks like. I think that is That is so critical. It's also, thinking about the long-acting options for both treatment and for prevention. And I should note, for those who maybe are not as familiar with these are strategies where there are newer formulations of the medicines that treat HIV and that can be used to prevent HIV, where you can receive an injection, for example, and that can last for a long period of time, stretching into weeks or months, depending on the options there. And I have to say, thinking about adolescents' creativity and their solutions, I think adolescents have been asking me about why they can't have, an injection that would cover them for their HIV treatment for, at least a decade, like long before we really had these formulations anywhere close to being a reality. And now they are a reality. And of course, taking those steps to then, again, thinking about equity and what it looks like to increase access, especially for young people and especially for children too, where often we don't study these new medicines or new formulations, and where it takes a long, long time to get the approvals for them to be used in younger populations. Children and adolescents need these things too, and anything we can do to move those forward. And I know, because you've been involved in some of those trials, I think, even when we can bring those research studies down to younger ages at all, even below 18, let alone, into the child years, that makes such a huge difference for the populations that are often the most vulnerable to some of these challenges too, that are looking, for some of them, at lifelong therapy with medicines and really do need other options. So it is amazing to see those start to move forward. Well, I am very aware of our time and want to respect everyone's time. So let me just say out loud, as was mentioned in the chat as well, that you're welcome. People are welcome to submit questions and to ask some things here. I see there are a few questions I think maybe we could start to talk about already. We've addressed this a bit in terms of how, I think we've already talked a bit about how the COVID pandemic has impacted adolescents living with HIV. There is another question for you, and maybe you want to talk about this a little more, Dr. Becker, about how the health system in South Africa has pivoted to meet the needs of the population living with HIV during the COVID pandemic in specific. I also see some questions, and maybe you want to fold this in, about how the variants in COVID as they're emerging are affecting those with HIV in specific as well. So maybe thinking about both the health system locally, as well as some of those specific issues related to the variants as they're emerging, and whether there are changes to impacting them even further, whether it be lockdowns or other things with that.
So let me start by saying that thanks, Rachel, and thanks for those great questions. Let me start first with COVID generally and HIV in this country. So the good news is that South Africa and the continent at large has actually moved ahead of the rest of the world around differentiated service delivery. And I think maybe that's, necessity is the mother of all invention. And, I think just as our clinics became so incredibly congested and so full, we started to have to say, well, we need another solution. I think asking people to wait 5 hours in a queue to get their monthly antiretrovirals was beyond anything that was tenable. And so we quite quickly went to multi-month dispensing. So people get 2, 3, even 4, 6 months of treatment at a time. And we also moved to out-of-facility provision of antiretrovirals. So people can pick up their antiretrovirals at depots, even in ATMs, in what we call adherence clubs, community-based hubs. And even adolescents can do that today. So it took a little while to, again, as you say, Rachel, we always tend to leave the adolescents to last in this regard, shamefully. But we do now even include adolescents in the adherence club sort of approach. So the upshot of that was when we found the facilities were shut down and very focused on COVID and COVID testing, there were still ways to get antivirals to people. And so we did not see such a big impact on the on a reduction of antiretroviral pickup, which I think is heartening and very very encouraging. However, testing, which tends to also be out of clinics, but happens a lot in clinics, fell off a great deal. So we saw far less diagnosis of HIV and therefore far less linkage to care. Now, again, the listeners might not be aware that we have about 8 million people living with HIV in South Africa today. We have about 5 million on. So we still have quite a way to go in terms of finding people who need antiretrovirals, getting them onto treatment. And children across the world are left behind in this regard. So again, we have not by a long shot reached all of our children. We're about half the population of children. And then we have not eradicated mother to child. So the other thing that regressed was making sure that women were booking, getting their prevention of mother to child transmission, being tested again, and accessing PrEP, which hasn't been something we've rolled out as we should have. So that's been distressing. And then the close cousin to HIV, of course, for us is tuberculosis. That's our other generalized epidemic here. And we saw a 50% drop in people coming forward for TB testing and for TB diagnosis. So there's no doubt we have a large population of people walking around with undiagnosed TB today. And that obviously speaks to, again, onward transmission. So that's been distressing. When it comes to COVID, we've had a number of studies done here, and I think it's quite heartening in a way. I think we had terrible doom and gloom in May of last year that we were going to see an annihilation of our population because of HIV. Our data shows that it's about a twofold increase in morbidity and mortality with COVID-19. So it doesn't go down age, it's just about HIV positivity. We haven't seen as clear a break on uncontrolled HIV versus better controlled HIV, but I think it's just data is quite difficult to process. But it does look like there is some additional problem with HIV. We've just looked at our big COVID vaccine study that you mentioned, Rachel, 500,000 healthcare workers, 40,000 of them were self-report HIV positive in that vaccine trial. It seems that the single dose J&J did stand up for hospitalization for ICU, but we saw a slight decrease in the vaccine effectiveness for death in the HIV positive community. It wasn't abrogated, which is good news, but there was a slight reduction in VE. So I guess we know that probably that's a population that is going to need boosting more frequently down the line. When it comes to, and I see those questions about Omicron, we are all coming to terms with Omicron at the moment. So we've had a big cluster outbreak in one part of the country. It definitely is moving around the country. It's too early for us really to say how the clinical phenotype looks. I think we're still going to have to wait a couple of weeks to see how that plays out. What I can tell you somewhat anecdotally is, and I think this follows what we've seen in other parts of the world also with Delta, is we are seeing younger people in hospital with Omicron. And that may be about vaccination, right? Because like everywhere else in the world, we started vaccinating our older population first. We haven't vaccinated our youth population in a big way. And so that may be a reflection of vaccination rather than of variant. So I think just too early, but we'll keep you posted.
Yeah, absolutely. And, and I think that is just to emphasize, as we're all, hearing about this and worrying about this right now, I think that really is the critical area for inquiry right now as we think of these variants that, yes, we recognize these mutations and we are worried because this variant shows a lot of mutations in ways that we wonder if it's going to impact the virus's ability, of course, to escape from the vaccine's protections and things. But it's really too early to say in this, and that's where we need to follow. And again, that we should be, I would note, thankful and offering applause as a global community for the scientists moving forward more information about these things rather than moving to immediate, almost punishment and isolation when we start to worry about something new in this way. So we do appreciate the efforts of South African physicians and scientists and testing centers in particular sharing this information, as we've, of course, seen that, it is rapidly also being, it's clearly has moved to other parts of the world as well, and had moved, and we will need to continue to monitor that as closely as we can. I think one final thing I wanted to touch on that ties back to something else you said, Linda Gale, was, I do think that there is, I don't know, this whole cadre of perhaps unsung heroes in the midst of this global pandemic, that I would describe as sort of the broad group of community health workers, of more like some of the peer, supporters, navigators, mentors, doulas, the broader group of people, with different names for these groups in different places, but those people who have, I think, we've seen over and over again, been continuing valiantly to be in communities, helping with testing and tracing, delivering medicines, helping people to access care when they most need it, when health systems are shutting down and they're not sure, how to move forward. A group that I think have, really struggled to be, to get appropriate PPE, to be considered in nations' responses in terms of, who needs PPE, who needs vaccinations, et cetera. This sort of unrecognized and unsung group of heroes that really, in many cases, I think, are the most effective often in maintaining health and protecting people, in connecting, whether it's people living with HIV or with other health challenges, into services. And I think just to recognize them broadly, but also, thinking about how, when we consider really vulnerable populations, whether those with TB, whether young people and adolescents in the midst of this, whether those experiencing violence in homes and things, it is often these critical community members who've taken additional, additional training, additional burdens of responsibility for their communities among themselves, that are maintaining what, we in our health systems and so on are too often failing in, I would say, as well. So I think that's a really critical point in this also.
Couldn't agree more, Rachel. And just a week or two ago, I gave a talk and reflected on the history, because there is no doubt our HIV epidemic was solely dependent on that cadre. And again, now here they are in COVID-19, and yet they continue to be an unrecognized, unfunded, often forgotten. And they took part in the activism that brought ARVs, again, the activism that brings vaccines, the advocacy for better care. They provide better care. You're absolutely right. All of the outside of facility, community-based, differentiated service delivery is on the back of these lay workers. And then finally, they actually often are the souls that provided the emergency responses for food and provision and everything else. So, extraordinary that here we are in another epidemic, a new epidemic, and again, they are unfunded, unrecognized, really in a non-systematic way included in our health systems. And that really, to my mind, is a continued failure on our part. And I think that's something we can definitely fix going forward in a very forthright way. And I look forward to continuing to advocate along with people like you. I think, thank you for raising that.
Absolutely. Oh, you're so welcome. Thank you. You were the first one who noted it there. So I know we need to draw our time together today to a close as we mark this World AIDS Day, where the global theme is end inequality and AIDS, and we've chosen to, spend this hour really trying to think of this theme of ending the HIV epidemic for the world's children. Of course, recognizing within that the need to end the other pandemic, and of course multiple pandemics in many ways that we are struggling with as well, with COVID, with TB, with systematic inequalities and so on as well. I wondered, Linda Gale, whether you wanted to share any sort of last message of what gives you hope as we think about what it would look like moving forward to end the HIV epidemic in particular.
Yeah, Rachel, I think what gives me hope is that even when political ideology or, political powers don't always go the way we do, the inherent humanity that we have within each of us, that real sort of passion for humanity, wanting to make the world a better place, even what you've demonstrated and the people who've attended this webinar today have shown that there is hope for global humanity. If we can really join hands, I think it is possible to meet those targets. Our eye is on 2030 now. And I think, with a redoubling of our efforts, even with the distractions of COVID-19, I think we can make that work for the good and catalyze our efforts to reach the goals to end the epidemic, particularly for children, by 2030. And I'm delighted to walk that journey with people like you.
Thank you so much. Thank you so much for your time today with us, Dr. Linda Gale Becker. It's really been a delight to have you. I know the day is late in South Africa, but we appreciate your work throughout and really the light that you have been shining away for us to continue as well. So thank you so much, and take care, everyone. Again, we appreciate your time with us today. Bye.
Bye-bye.